This video is about the Medicare coverage of abdominoplasty post-weight loss. People often ask me, can Medicare cover my abdominoplasty, also known as tummy tuck, after weight loss? Well, the short answer is sometimes, and it depends. Also depends on what you mean by cover and fully cover. There are very specific medical criteria that apply to each of the MBS numbers. In this video, I'm going to go explain exactly when Medicare applies, which MBS item number matter, and what you need to have in place before you even do a booking. And if you are looking to have the surgery, then make sure you make an online booking down the bottom and come and see me in the office. The one rule to understand first is that Medicare doesn't apply for cosmetic surgery. Cosmetic surgery is really defined as anything that doesn't get an MBS item number or complies with the requirements of Medicare. Medicare only applies when a procedure is medically necessary, and medically necessary is defined as the descriptor of the MBS item number. Not medically necessary is no MBS item number. No MBS item number means that you can't access Medicare. And also, this is very, very important. You can't use your private health fund. A lot of people get confused because they think that their private health fund will pay for a abdominoplasty when doesn't have any Medicare, but that's not true. You have to have a Medicare item number to be able to use your private health fund. And that's something that, you really, really need to understand if you're looking into funding your abdominoplasty. So there's several different criteria for the MBS item numbers. For post-weight loss, the key requirement for that is that you've had significant weight loss. Now, Medicare defines significant weight loss as you've lost 5 BMI points. So the kilograms in this matters is different for every patient. And I'll go through a couple of examples of what 5 BMI levels mean in real numbers. Now, the weight loss that you have can be either lifestyle changes, bariatric surgery. Those are the most common. And certainly the bariatric surgery has been in the past the most common that I've seen. However, medication and lifestyle changes have become a lot more common now that we have quite effective medication for weight loss. Pregnancy weight is excluded from this calculation. So you can't be pregnant and have a baby and then say that you've lost the weight. So that's a specific thing that is specified there. So if you're 170 centimeters tall and you go from a BMI of 35 to 30, that is a weight loss of about 14 to 15 kilograms. If you're 180 centimeters tall and you have a BMI of 38 and you go down to a BMI of 33, that is about 16 to 18 kilograms. So majority of the time for most of my patients, if you've lost in the range of 15 to 20 kilos, that would usually satisfy this rule from Medicare. Obviously, with shorter patients, the kilograms would be a little bit less, but generally 15 kilograms for most people would be pretty accurate. Medicare, one of the most important criteria that you must meet if you're using the MBS item numbers for post-weight loss abdominoplasty is you have to have lost 5 BMI levels, and that has to be documented as well. So if you are thinking of losing weight, especially if you start on weight loss medications or you're thinking your lifestyle changes or you're going on a diet and you want to maintain that, go and see your GP, get them to document your weight, and make sure that gets documented throughout your weight loss journey, because that's probably the most important key component of the things that we need to know, and I need to know for your MBS item number. Now, so that's one criteria. Then the second criteria is medical issues that come from the loose skin. So if you have recurrent skin conditions ongoing skin breakdowns, hygiene issues, functional issues such as, the loose skin is interfering with your work. It's difficult exercise, moving because you've got loose skin that's interfering with that. And that's something certainly that I see a lot of as well in my patients after weight loss. Go to your GP, get them to document that, and the other criteria is that those issues can't be resolved by medical treatment. So you can't use steroid creams, you can't use other creams to get rid of the rashes. There's no other way of getting around the loose skin other than cutting it out with surgery. So the conservative treatment is another criteria that Medicare uses. So the key points are your BMI change, issues from the loose skin, and conservative treatment has failed in resolving the issues that you have from your loose skin. Now we're getting down to the actual numbers that you're going to need. And remember, we'll give you the numbers anyway on the specific operations that you have. So you don't have to remember these, but it can be good to know the numbers so you can check with your private health fund if you're covered or not. So the main number is the 30177. So that's the radical abdominoplasty after weight loss. And that's certainly the most common item number that I use. That's used for abdominoplasties, fleur-de-lis, and also the dual vector abdominoplasty. And the requirement for that is the 5 BMI level, functional skin issues, and that can't be resolved with medical treatment. The other item number is 30179. That's 30179, and that's a circumferential lipectomy. That for the circumferential abdominoplasty, obviously, or the 360-degree lipectomy, or also referred to as belt lipectomy. And that's a common operation for my post-weight loss patients as well. Again, same criteria as the other ones. You have to have lost the weight and have rashes and have loose skin. The other one is the 30166, and that's not a very commonly used one. That's wedge excision and limited removal of lower abdominal apron. So that's not a full abdominoplasty, and there's no muscle repair of that one. That will be mainly used for a apronectomy or something like that. Something that's on the lower abdomen, something that's hanging. Again, not very common. Most of the time we are doing a comprehensive abdominoplasty, dual vector, hybrid, circumferential, or any of these sort of other bigger operations to remove a lot of skin. Now, stay with me. This is probably one of the most important things to know when you are looking at the cost of your procedure and quotes and MBS item number. And that's Medicare and the private health fund. Now, private health funds get part of the funding from Medicare. So if you don't have an MBS item number, your health fund will not cover you. And that's something that's really, really important, because I have a lot of patients come in and say, oh, but I have a private health fund, so it's okay that I don't get an MBS item number. No. Or that I don't use Medicare. No. You have to have an MBS item number for the health funds to cover you. The health fund actually claims back part of the cost from Medicare. So if you are getting, let's say, an abdominoplasty using the 30177 MBS item number, then once the health fund pays your rebate back, then they claim 75% back of the Medicare item number from Medicare. And that also determines how much the health fund will usually pay for the MBS item number, because they tend to have a percentage. So for example, if the MBS schedule fee is $1,000, then the health fund's going to have something like 120% of that or 160% of that they give to you. And then they claim back 75% from Medicare. Now, the key thing with the MBS item number, if you are covered and you have private health fund, you will get some money back from health fund for the anesthetic, assistant fee, and my fee, but you will have a gap to pay, and that's what the quote is for. The other big thing is that If you have a private health fund, it will pay for the hospital. And the hospital is a really big chunk of the cost of the procedure, especially with these operations that can take, 4, 5, 6, maybe up to 8 hours. If you're paying that with your own money, then that time in theater and the hospital stay is a massive cost usually. And that's the one that usually the health funds cover. And that's usually one of the biggest benefits of having a health fund. The other big benefit of having a health fund is that if you get a problem, for example, if you get a bleed, hematoma, if you get a seroma that we have to take you back to theater, or wound debridement, or a serious infection that has to go back to the hospital, then you have your private health fund and that's covered. And generally when you have a complication, I don't tend to charge. So we do a no gap and my anesthetist does the same. So that's really, really important to consider as well. Now, how does it work when you come in to see me? Well, I'll do the consult. We usually have a 1-hour initial consultation. Then my patient coordinator will send you a quote, usually, because she usually does it either on the day or the next day, with MBS item number with my fee. She will then contact the anesthetist and they will send you a quote as well. And that will have their item numbers. And anesthetist item numbers are very different from mine. They base that on health conditions, time of its surgery takes, etc., etc. So they have different item numbers from the surgical item numbers. And again, you can check that with the health fund. That way you can actually ring up the health fund and say, these are the MBS item numbers. I'm having a medical issue. Am I covered? Most private health funds will only cover the post-weight-loss abdominoplasty in the top tier gold cover or top level covers. And they lump it together with weight loss surgery, which is a bit of a funny thing because it's not weight loss surgery, but they all put it together with a bariatric surgery, lipectomies, abdominoplasties, all that comes together in one lump, one band for them. So you need to check with the health fund about those, if you're covered or not. The other thing I would say is, if you're not covered for that actual operation and then you end up with a complication and you have private health fund, a lot of times we can actually admit you to hospital and the private health fund covers that section because it's in a lower band on your private health insurance. So that's something to keep in mind, that even if you may not be covered for the abdominoplasty, you may actually be covered for dealing with any complications. So once you get your quote, you can check that. And the other thing that we do is that the hospital would then call the health fund and make sure that you are covered and that the hospital item numbers are all correct. So that's how that initial thing works. And then obviously once you have the MBS item numbers, the health fund can tell you how much exactly you get back. On the quote, we usually tell you what the MBS schedule fee is, but you generally, if you have a private health fund, you will get more money back than we put on our quotes. So once you call the health fund, you'll know exactly what you get back, and then you can basically work out exactly how much everything's going to cost down to the last dollar. Now, why would Medicare decline your claim? So the main reasons is that you don't qualify for the BMI changes. It's not documented, so that you don't actually have any documentation on weight loss. There's no documentation from the skin and functional problems. There's no GP letter that you haven't seen a GP, and there's no evidence of conservative treatment being done or that you've seen a GP. So those are kind of the things that would mean that you can't claim an MBS item number. Now, if you've had significant weight loss and are wondering if Medicare applies, the first step would be to see the GP, but they're not usually experts in abdominoplasty or how the MBS surgical item numbers work for surgery. So really, you see the GP, they write a referral to me with a specific item that we need, and then when you come and see me, I will assess all the information provided and I'll determine if you are eligible or not. So that's really the important thing, is the specialist surgeon, me, that will then look at all those things and determine if you are qualified for MBS for Medicare or not. Medicare itself doesn't do anything. It's a surgeon that actually decides based on the information provided what MBS item number we can use or can't use. Now, make sure that you book your online consultation with me. Hopefully you found this useful. Comments are all very, very helpful. This information is for an Australian audience. So obviously, if you're not Australian, this is not very useful. And come and see me in the office.